Good day, folks. Alfie Vente here, once again at Vente Pain Relief Clinic and VPRC.ca. Welcome to our soft tissue case study, Losing His Grip. This is part two, the answers and discussion portion. Last week, we put out the first part of the case. So hopefully, you've taken some notes down and we can talk about the answers and discuss this case. Also, stay to the end because we have a bonus. We have a treatment tip at the end in regards to the soft tissue case study. So now let's go back to reviewing this case. So your patient client enters your office and their main complaint is pain and tightness down the right arm, all the way down to the fingers and hand. It becomes more aggravated whenever certain resisted exercises are performed. One exercise in particular seems to aggravate more relative to other exercises. The biceps curls with forearms in a neutral thumbs up position. The hammer curl position. So if you've ever done a hammer curl with your thumbs facing up and you're holding the dumbbells, that's the position that the person encounters this discomfort. It seems to cause more pain. There's also some weakness of grip strength with some pain when performing resisted exercises that require gripping, for example, when performing pull-ups. He is a 35-year-old male who works out between 4 to 5 days a week, usually for an hour and a half. He has ramped up the workout intensity and he rarely stretches. His favorite exercise is the bench press and admits to overdoing it at times by doing a lot more sets than other exercises. He has noticed the symptoms develop over a few weeks. It was more apparent during exercise, but now he notices low-grade pain along with tightness down the arm when at rest. Professionally, he is a dentist and works between 8 to 10 hours daily. So you can see with the video there, that's the hammer curl, the thumbs up position, and that's the pull up there on the bottom right-hand side. Key observations. So it includes upon palpation, it is obvious that the muscles and soft tissues of the right side of the neck, pectorals and upper extremity are extremely tight. His right shoulder is more rounded forward relative to the left. There seems to be more tightness and tenderness in a number of locations into the right scalenes, pectorals, lateral triceps, and around the radial head. Left side bending and rotation to the left of the neck with arms at the side seem to cause a tight feeling down the right upper extremity. The fascia from the hands to the chest and neck is severely tight and seems to be immobile and tender when palpating. Wright's hyperabduction and Addison's test are both positive for the right side. And finally, resisted elbow flexion is painful, but more painful when the testing is done with a neutral forearm position. Again, the thumbs up, the hammer curl position. So these are the key observations, the key areas upon palpation that were tight and potentially tender. The scalenes, the neck area there, the pectorals, shoulder area, the lateral tricep, and around the radial head. As a review from McGee's Orthopedic Physical Assessment, this is Wright's for pectoralis minor syndrome and Addison's for scalene syndrome. So those are the two tests that this person has shown positive for. These are the key questions that I'd asked previously last week for part one. So what structures do you believe might be causing your patient's symptoms? It's structure or structures. What are the clues that helped you come to that conclusion or conclusions? How do you think these symptoms came to be? Explain the causes of the patient's presentation. Are there other orthopedic tests that you think would be appropriate for this case? So these are the 4 questions that I had asked in the previous part one, so that you can think about it, write it down maybe, and hopefully answer them for part 2 today. So let's go on to answering these questions. So number 1, what structures do you believe might be causing your patient's symptoms? Based on the clues that have been given in the case, it seems that this is a potential issue with the radial nerve becoming entrapped. So It's mostly, I'm going to say it's mostly radial nerve because of the way that the person's presenting. As you can see there, this is from Gray's Anatomy. The radial nerve is in yellow, and its path down the arm. Again, like if you wish to comment or discuss this, feel free to comment below. What are the clues that helped you come to that conclusion or conclusions? So what were you thinking? This is the same picture, but it's basically, sorry, it's not the same picture. This is the supinator relationship to the radial nerve. You can see I've circled the deep branch of the radial nerve. It is passing underneath the supinator there. You can see that. So what are the clues that helped you come to that conclusion? So symptomatic when patient performs resisted flexion with the hammer curl position. Brachioradialis, that's the action of brachioradialis. It is innervated by the radial nerve. A weakness of grip strength, according to the Cleveland Clinic, a radial nerve injury can potentially weaken grip strength over time. So what this person might find, or what somebody who has potential injury might have, is that they may be having difficulty in terms of doing certain exercises when it requires gripping. Now, I have to acknowledge that most common site of entrapment is around the elbow extensor surface through the radial tunnel. This is basically the diagram there on the left-hand side. This is where it's most commonly, where the issue can commonly present. At times it could be because of a fracture in the area, potentially causing an irritation to the nerve. Tightness is found around the area of the radial head. Continuing on with this, patient is also performing an exaggerated amount of bench presses with minimal stretching. This could tighten muscles through the course of the nerve from the neck, shoulders, and through the elbow and the forearms. Also note his profession as a dentist. When he has basically a head forward position, and he does this for prolonged periods throughout the day, potentially tightening the scalenes muscles, exacerbating his condition. So the bench press, it can, if you're not stretching, it can tighten up the pectoral area, the shoulder area, and also you are also using your triceps, and that could be an issue over time if you're not stretching. It can cause an irritation of the radial nerve. Going further with number 2, what are the clues that helped you come to that conclusion or conclusions? Although not directly confirming radial nerve injury, he was positive for Wright's hyperabduction and Addison's. Remember, Wright's hyperabduction tests for pectoralis minor, and Addison's is for the scalenes. It was also noted that the lateral triceps was very tight in an area where the nerve courses. It seems the nerve potentially was compressed through its course from the neck, shoulder, triceps, and through the elbows and forearm area. So you can see the diagram there where the tightness is the scalenes, pectoralis minor, the pectoral area, the shoulder, the lateral triceps, and radial head. Now, you got to remember, like, these presentations aren't fully textbook, right? So that's why I said earlier that it's mostly radial nerve because of the way the person's presenting. So let's go on to the third one. Let me just move myself here a second so you guys have a better view. How do you think these symptoms came to be? Explain the causes of the patient's presentation. So it seems that a combination of overdoing it on an exercise like the bench press without much stretching and his posture as a dentist contributed to his condition. A likely scenario is that along with exercises such as the bench press, his overall upper body routine without much stretching has contributed to this overall presentation. So you can see on the left-hand side there, I've got pictures of the dips, the bench press, and the hammer curl. So just overdoing it on these things can potentially cause issues where the nerve can be entrapped. especially where it courses from the neck, down the shoulder, through the elbow, the forearm. So, are there other orthopedic tests that you think would be appropriate for this case? So there's a number of them, of course. It's actually these might be some of the ones that you potentially could have thought of, like in the beginning. The upper limb tension test for radial nerve could be one. Triceps reflex, that's because the radial nerve innervates the triceps. Sensation for the dorsum of the hand, so checking to see like if the sensation has changed relative to the opposite side. And also testing the strength of triceps, brachioradialis, and the wrist extensors. So those are some of the things that you could potentially use. I don't know, you could think of other things too. Maybe not directly testing the radial nerve, but sort of ruling out certain things that this might present as. So thank you very much for watching. We really appreciate it. Please like, share, subscribe, and pass this on to those that you feel this might be helpful for. We want to thank you in advance. And also ring that notification bell if you're watching this on YouTube. And follow our social media. We also have a bonus in terms of like this case itself. It's my own kind of tip, a clinical treatment tip, working with the soft tissues. So let's get on to the bonus. Although the radial nerve is the primary structure injured, and intuitively you may want to strictly focus on the triceps and forearm, you may want to zone in on the scalenes and pectorals, and there's a very good reason for that. In this particular case, where the neck and shoulders are tight, what you may find is that by intentionally focusing on the structures, that it may actually decrease the tension through the triceps and forearms. So remember that this is why I'm saying like it looks like it's mostly radial nerve, but there could be some stuff happening up here, that could be tightening up on the nerve, that could be compressing on it, and giving symptoms down the arm. And what, as I mentioned, what you may find is that by actually releasing up here and the pectorals, that you'll find that down the chain, you'll find that the triceps and the forearms may relax, and that you're actually able to go in there and do a bit more work. Because what you'll find with this type of case is that if the muscles are super, super tight, like it's very, very hard to relax them. So you might have to find a different way to go about it to get these muscles to relax. So there you go. That's the bonus soft tissue treatment tip if you have something that's presenting in this kind of fashion. All right. So we really appreciate you watching. We thank you for doing that. My name again is Alfie Vente of Vente Pain Relief Clinic and bprc.ca. You can reach us at 416-644-8894. That's our clinic number in downtown Toronto Financial District. Or you can email us at admin@ventepainrelief.com. Have yourself a great day, and we hope you enjoyed this video. Remember, we've got more videos coming up in regards to the soft tissue case studies. They should come out weekly, hopefully. Anyways, have yourself a great day, and we'll talk to you soon. Take care.